both the Microsoft and also teaching. Teachers are reported to be exhausted and being burnt out from parallel systems. So there is a need for us as a sector to strengthen our work around psychosocial support, both for learners and teachers. Also, school nutrition had presented itself to be a problem. Personnel provisioning, because of distancing and remodeling and re-timetabling, did present a number of challenges, as well as high levels of readiness according to around facilities. And our biggest challenge has been about around water and sanitation and the compliance with COVID-19 protocols. The Director General continues to convene one-on-one meetings with heads of provincial departments to ensure that there is continuous sharing of experiences and working together. Also, as MECs, we meet at least once a week, again to share experiences and evaluate and assess the work that we're doing. So interestingly, there is concordance between the reports generated from these one-on-one meetings with provinces, but also from reports that we receive from the consortium led by the NECT, from your SGB school governing bodies, but also from the teacher associations that are represented nationally. Now, on Thursday, the 2nd of July, we met again with MECs and considered a number of variables which inter alia include the rising community infections across the country, especially in the three provinces, Gauteng, Western Cape, and the Eastern Cape, including KZN, and looked at the risk-adjusted, differentiated approach in dealing with the returning grades to school. And this is what made CEM to consider even staggering further the returning of grades so that we don't return all the grades that we had gazetted that will be returned, that were meant to be returned tomorrow. So on the 3rd of August, we reconsidered the plans that we on the 2nd of July, we reconsidered our plans for the 6th of July and the plans for the 3rd of August. Firstly, CEM agreed that only grades 6 and 11 will return tomorrow, and provinces that are ready and institutions that are ready will then also phase in the ECD programs. Because there are some schools, especially your private independent institutions, which had already started getting ready for ECD programs and are very ready. And we have agreed that those will be allowed, but ECD centers in schools will be phased depending on the readiness of the school, but it has to be done within the gazetted timeframes. CM noted that provinces are at different levels of readiness to return grade R learners. Therefore, we agree that those provinces that are not ready to receive grade Rs tomorrow must provide strategic and realizable plans to ensure the reincorporation of grade R learners to school within and not later than the end of July. However, provinces that are ready to receive grade R learners tomorrow can proceed to receive these learners. But what is critically important is that all grade R and pre-grade R learners in schools who have already returned to schools must remain in schools. And those schools that meet the health, safety, and social distancing protocols can reopen for their grade R and pre-grade Rs tomorrow. We will continue to work with national associations responsible for learners with special needs to streamline the return of these learners to schools. A further agreement by CMs that all grades that are part of the second cohort should return to schools in an orderly, staggered fashion within the timeframes that have been gazetted. Before I conclude, because indeed, when Cabinet gave us permission or approval to start reopening schools, the first condition was safety in schools and making sure that indeed we monitor the risk of having schools as centers where the virus will be spread. On the first issue, it should be emphasized that temporary closure of schools, which was less than 4% after the schools reopening, is much better, we think, than a system-wide closure over the same and even longer period of time. As I said, the 40% of the 25,000 schools, it means 25,000 schools remained opened, they were never interrupted, and less than 1,000 schools were affected and had to open and close. Because if we would close all 100% of schools because of the 4%, it will come at a very unacceptable cost of lost learning and school feeding for an entire generation of children, with a consequent worsening of social and economic inequalities for years to come. It has not been possible yet to measure the impact of the current school closures on learning, since no significant assessment of learner performance has been done. However, international and local evidence around the typical impact of losing school time due to disasters like strikes suggests strongly that learning losses may well be greater than what is suggested by actual days lost. This so, in a large part, system disruptions result in learners forgetting some of what they've been taught, and teachers being forced to go even days or areas back in order to enable learners to catch up. So one of the forthcoming surveys of households across South Africa on the coronavirus rapid mobile survey is busy collecting information on childcare activities, on child hunger and access to educational content when children are being kept at home. So preliminary yet unpublished results from the first wave of data collection indicate an alarming increase in child hunger since the national lockdown. The survey is also suggesting that a significant increase in childcare responsibilities has increased the burden on women. The survey also confirms that less than a third of children that have not been attending to school have not accessed any education through the internet, with a larger proportion of them accessing education through books, through television and radio. However, the effectiveness of these two activities continues to be uncertain and are likely to be less effective than attending school. But what the survey confirms is the usefulness of books and printed materials. That's why we want, again, communities and families to make sure that children are kept or are engaged constructively during the lockdown through books and through different activities that will keep them stimulated, so that as they stay longer at home, they really don't suffer longer consequences of lack of stimulation. So from the planning side, we will be convening a DBE discussion on the findings of this survey to continue to monitor what the impacts are of a continued lockdown or the continued virus lockdown, enforced lockdown on the lives of children. There's a report also, because as I say, we had to monitor what the infections what are the risks that are brought by the reopening of schools to teachers and learners, because that was a condition that we were given when we had to open schools. So we have to monitor and report on that. So unfortunately, we must honestly say we currently do not have any data or dates of infection as confirmed by the number of cases of virus amongst teachers and learners. That's why when we mention the statistics of teachers who have already passed on and learners, and it was confirmed that the majority of them will not have even reported in schools by the time they succumbed to the virus. But what we are currently doing is to put in place mechanisms and also be very vigilant to make sure that there is no risk or instance where schools themselves become epicenters for the spread of virus, because that was one of the conditions that were given to us, and therefore had to monitor it. So what we are committing to is that indeed in the next round also of reporting, we assume that we will have, or we commit that we will collect as much evidence that will confirm that indeed schools have been centers of the spread, or schools have been the risk of spreading the virus amongst children and amongst adults. So we will give the results in days to come, but for now we don't have any evidence that confirms to the fact that schools have become risk factors. But as I say, we're very careful to make sure that indeed we can overcome that or we can avoid that. And that's why even the staggering of classes, just to make sure that we don't really take any chances or really risk schools being centers of the infection. So in conclusion, I really want to appeal that unity among stakeholders has been phenomenal. and we are very grateful and appreciative for that. Parents have been very helpful. Teacher organizations also have been very helpful in terms of giving us information, guiding, and making sure that we are all as a sector constructively and honestly engaged so that we don't make any mistakes, because it's not in the interest of anyone to harm anyone within our sector. So we have a lot, we still believe that we have a lot of work to do still. The virus is still with us, and unfortunately the infection rates are increasing, and we are told that it's going to continue to remain with us for some time, but we believe that through collaborative efforts we can overcome and we can be able to work together. So we do appeal to each and one of us to cooperate with the sector and with the education to ensure that we put the interests of our children and of our educators, including our parents, as a top priority on our list. So I really want to thank you very much, Chair, and thank again the public and the committee for all the support that we enjoyed during the month of June.
Thank you very much, Minister. I'm now going to ask the Director General of the Department of Basic Education to come through to deliver his presentation. Mr. Mweli, your presentation is ready. I'm going to ask you to please take to the stage. Thank you.
Thank you very much, Program Director, Mr. Mtlanga, the Honorable Minister of Basic Education, the Honorable Deputy Minister in absentia, hopefully linking from Mpumalanga, the Honorable MECs who are linking from their respective provinces, fellow South Africans, brothers and sisters. Last time, when I occupied this space, I indicated that on the 1st of June, we had anticipated 1,600,000 learners to resume schooling, which constituted 13.4% of the 13,100,000 learners. The Minister has now announced that learners will be coming in as the second phase of the group of learners. Will be starting with schooling tomorrow, continuing with schooling since the lockdown, is grade R. Grade R constitutes 775,820 learners, which is 6.3%. Grade 6 learners constitute 992,133 learners, which is 8%, 0.8%. Grade 11 learners constitute 824,802, which is 6.6%. All in all, by the end of the month of July, we are expecting the next group of learners, which is 2,592,755. All in all, this would make up 20.9%. If you add it to 13.4%, it will give you roughly about 35% of the total number of learners. I am now going to quickly go through the presentation that is entitled COVID-19 Basic Education Sector Risk-Based Differentiated Approach in Reopening Schools. In other words, this presentation would be saying, under which context are we reopening schools? Professor Karim, when he made a presentation to the nation, he referred to small flames in the bush. And where are the small flames in the context of the basic education sector? That's what this presentation is going to attempt to do. Okay. Well, in terms of the introduction, the minister has already covered the impact of COVID-19. As we can all see, in terms of the world-renowned institutions such as UNESCO, the World Bank, the World Food Programme, that impact has been assessed, including what was covered in the speech of the minister. The latest assessment, which we shared with the Portfolio Committee on Basic Education and the Select Committee Minister, goes even beyond what we are sharing with the nation today. It looks at the number of schooling days that learners would have lost who are part of the cohort of the 2020 academic year. The analysis goes to even projecting future earnings of these learners because of the learning and teaching that they would have lost this year. I will now move to the next presentation, which is really the risk-adjusted strategy which the President addressed the nation about, 5 levels of the risk-adjusted strategy that is used by our country. And we use the risk-adjusted strategy to plan for the reopening of schools. And as you can see, it's got 5 levels. And what I'm going to do is just to indicate how we have worked out even the criteria of phasing in schools. You can see that at level 5, we didn't expect any school to be operating. We had planned to start grade 7 and grade 12 at level 4. However, we delayed the phasing in of those grades and only brought them in at level 3. And you can see that the other grades were, of course, planned for level 2 and subsequently level 1. The rest of the learners joining those who would have started schooling. And because the country is now at level 3, and we're only going to have grade 11 and grade 6 and grade R joining grade 7 and grade 12, we are still, as the minister indicated, going to even stagger these other grades. And just to remind the nation, the group of learners who are supposed to start from tomorrow would have constituted 52%. Now, given the reasons that the minister has already shared with the nation, the number has been reduced to what I've already shared here as well. I just want to indicate that we use this information, which is based on the prevalence of the virus in the 52 district municipalities in the country. And this is information collected by the Department of Health, information collected by medical experts, as well as scientists, the best in the country, including the Department of Science and Innovation, who are plotting the prevalence of the virus across the country. And what we have done is to use the geolocation of each and every school to indicate where these schools are located in terms of the prevalence of the virus. Now, you'll appreciate that because the information is now coming in the form of packaged in your titles such as where the Department of Health will talk about a vigilance level, which is the first level that they've now created. The second level is called emerging hotspot, and the third level is now called hotspot. We've now combined level 2 and level 1 into vigilance level, and then level 3 and level 4 is now combined into emerging hotspot. And hotspot is, of course, level 5. We know that originally we had 6 metros which were identified as hotspots. So those 6 metros are still part of that, but there are other areas in the country that are also joining the 6 metros. Now, as we can see, this is the interactive data that we have, which we'll share with the nation, and it will be available even for access from our website. And this is how the information is broken down, and the number of schools nationally. You can see those that fall within your vigilance level and those that fall within your emerging hotspots, and schools that are also falling now on the hotspot areas, the 6 metros, and some of the areas where community infections are increasing. And we summarize the information as indicated there. As I have explained, level 1 and 2 will be your emerging level, and of course level 3 and 4 will be, vigilance level, and level 3 and 4 would be emerging hotspot, and level 5 would be your hotspot. That is the national picture. And then if we look at provinces such as the Eastern Cape, the Eastern Cape has got 2 metros, Buffalo City and the Nelson Mandela Bay. As we can see, those 2 metros are where community infections have really been growing, apart from the other small areas in the Eastern Cape. Now, this is how we have plotted our schools. You can see the number of schools that fall within vigilance level, and those that are falling within emerging hotspots, and those that fall within the hotspots that we know in the Eastern Cape. And this is the summary of the number of schools, the types of schools as indicated there, and we even give the number of learners and number of educators per each of those 3 categories, summarizing the 5 alert levels that the country is using. But when it comes to municipalities, of course, we use those 3 categories. The next one is the Free State. Free State community infections are highest in your Mangaung municipality, as you can see. And we have also delineated the number of schools for the Free State. We can see a large number that falls under vigilance level, and fewer schools falling under your emerging hotspots, and the least number of schools under your hotspot area. And we summarize that as follows. And then when we come to Gauteng, we know that Gauteng, although the 3 metros, but all 3 metros viewed as hotspots. And as the Gauteng Department of Education was sharing with us on the 2nd, if you go to municipal wards, there are very few wards that fall within under your blue area, and most of them, of course, fall under your hotspot area. And as I've explained, the first group is your vigilance level, and the third group is which is the second group, which is the only group, and this pattern you'll only see in the Western Cape and Gauteng. From vigilance level, it goes straight to hotspot, which means that the community infections are highest in the country in those two provinces, and you can see even the number of schools which fall in the main under your hotspot area. So what the Council of Education Ministers also indicated was that provinces with this experience will have to cautiously take decisions to reopen for grades, and when they do that, they have to take into account the rising community infections there as well. And the information is summarized as indicated there for Gauteng. And then we move to Kwazulu Natal. Kwazulu Natal community infections were highest in eThekwini municipality, but we acknowledge that in other areas, rural and villages, community infections are also emerging there. And then this is how the information is delineated. 3 levels: vigilance level, emerging hotspot, and the hotspot area in KZN. And we summarize it as indicated there. In Limpopo, not real hotspots, very small areas in Limpopo, as we can all see. We have, of course, areas which we have classified as areas of vigilance level, and the next areas is emerging hotspot. So, and what is being emphasized throughout is non-pharmaceutical interventions or non-medical interventions that the minister referred to coexist with the virus, because we are told by medical experts that we will be with this virus for at least 2 up to 3 years. So masks, wearing of masks, basic hygiene, physical distancing should be the way to go going forward. And this is the breakdown of Limpopo, as you can see, those levels that are indicated there. And then with Mpumalanga, hardly any hotspot there, as we can see, and all the schools in Mpumalanga, as you can see, under vigilance level, but we're not saying that we should drop the ball there. We also insist on non-pharmaceutical interventions that I have just explained every step of the way from Mpumalanga. You can see it's only level 1 and 2. The other levels are not there, even in Mpumalanga. Then Northern Cape, just a small area. Minister, when we reopened schools on the 1st of June, 19 schools in the Northern Cape could not open. In one small area, because of the flaring up of the virus there, schools could only reopen on the 15th of June. But as you can see, the majority of the schools in the Northern Cape, few as they might be, they are under your vigilance level, and therefore emerging hotspot, which would be the area that I've just referred to. And that's the breakdown there. Basically 2 categories of areas of the prevalence of the virus. Northwest, the biggest area is Bojanala, Rustenburg in particular, but also vigilance level, the majority of the schools. And then in terms of emerging hotspot, which is definitely Rustenburg, and maybe a few areas in the Bojanala district, as indicated there, and breaking them down as indicated. And then the last one is the Western Cape. As we can see, the pattern in the Western Cape can only be compared to Gauteng in terms of the small flames in the bush that Professor Karim referred to. And as you can see, just like Gauteng, only two categories. You don't have vigilance level, you only have emerging hotspot and hotspot, and the largest number of schools being under hotspot. And also Gauteng and Western Cape proceeding cautiously as they reopen schools there. And many schools had to close and open, as the minister said, especially in Gauteng and Western Cape. And the information broken down as indicated there. Thank you very much for indulging me.
Thank you so much, DG. We will now continue to the next presentation. I'm going to ask the CEO of the National Education Collaboration Trust, Bawa Khosa Grimtsnela Lane Vatamvona Legian Kurinangwena Magingirika John. Your presentation is ready, Bawa Khosa. Go.
Failing to understand why you don't address the DG in Shangaan, and you only do that to me. I don't know whether that's some form of discrimination, but be it as it may, Minister, Deputy Minister and the MECs who are joining virtually, as well as the DG, joining us here, and everybody else, good evening. I am presenting a report on the readiness of the schools on behalf of the number of organizations that the National Education Collaboration Trust works with, and I therefore present on their behalf. The last time we shared our presentations with yourselves, we took different approaches. Now that more grades are expected to come back to school, we had to amend our approach to collecting relevant information that will be useful in determining the extent to which the system is ready to reopen for the rest of the grades as they come in phases. So we have added onto our methodology the assessment of national and provincial plans in preparation for the readiness. And in that regard, as you'll see, we had our first presentation to the Council of Education Ministers on Tuesday, the 2nd of July. And then we had an opportunity to present to the heads of education departments on Saturday, where we had collected additional information. So the report that I present would cover those 2 points at which we reported. The second category of information that we cover is the tracking and verification of the supply of COVID-19 essentials. And in that respect, we looked at information from all the 9 provinces, including disaggregated information from the districts, and in some cases from the warehouses that are involved in the delivery of such. The third category of information is school visit data. So as you'll see, when we saw the CEM on Thursday, we had processed information from 281 schools, and we have subsequently dug into the data that was available to the tune of 431 schools. So these are schools in whose corridors our team walked and looked at the availability and the practices that are expected in respect to the readiness of the schools to receive more grades. The next is telephone surveys, which we had done before, and we've now done about 470 of those. And the last one is principals focus group interviews. It was important, we felt, that we should have one-on-one conversations with principals who are really on the cold face of receiving these learners to understand how they have experienced receiving learners from in grade 7 and grade 12, and to get from them how they anticipate and plan to receive the rest of the learners coming forward. So it was important that we share with you how we gone about collecting the data. There's much more data that we have collected, and there's a whole of data that can be collected. And in that context, we had to think again about how we focus our efforts in a manner that we can advise or share observations with the Department of Basic Education on the readiness of the system. And as you can see, we have considered what we call universal health response, to COVID-19, which in the main includes social distancing, protective clothing, surface cleansing, and personal hygiene practices, all of which, we try to apply in the context of schooling. These were applied with the interest of, one, establishing the extent to which schools can limit or will limit infections, two, the extent to which schools will maximize learning, and three, the extent to which we will achieve sustainable schooling with minimum disruption of attendance in schools. So that focused our thinking, and therefore we clustered the information that we collected into four. The first is around the supply of protective clothing, or rather essentials, disinfectants, water, and sanitation, something that we did extensively in respect to the return of the first cohort. The second construct or a group of things that we looked at is the reorganization of schools. So to accommodate social distancing, to take into account comorbidities amongst both learners and teachers. And in respect to teachers, the management of comorbidities has an effect on how the schools organize the classes in a manner that kids can social distance, and in that manner, it informs timetabling. The third area is incident management. So when these small bushes in the fire that the DG referred to, flare up, how do the schools, the question was, how do the schools manage those? And the fourth and the last one is around psychosocial and community support. So the wellness of learners in psychological and social terms, and the extent to which the communities have been supporting the process of receiving back the learners. So that was important that I give you that background, and I'm going to pick up pace and give you just highlights of what we have picked up. So firstly, in respect to planning and monitoring by provinces and the National Department of Basic Education, the overarching observation there is that we have observed a streamlined national management and monitoring regime at national level, which obviously filtered down to the provincial levels, based on lessons that were learned in the return or during the return of the grade 7s and the grade 12s. And that we think improved the planning that filtered down to the provinces and the districts, as you'll see in the following slides. Some of the observations that we make from these planning documents are that indeed over 90% of the schools nationally were reopened on the 8th of June 2020. There were very few cases where schools were not open. And the reason cited for the failure of reopening of schools in those small number of schools, though in the main, those were cited prevalently were water and sanitation. To some extent, infections, infrastructure, community and vandalism and disinfection of the classrooms were cited as some of the challenges. And very in few cases, late provision of COVID-19 essentials were cited. We have also noted, from the reports, as the minister has indicated, that the infections indeed mirror the national patterns around Gauteng, Western Cape, and the Eastern Cape. But in particular, we paid attention to how the departments were planning to respond to these situations. And we found that indeed departments right across the nation closed the schools when they picked up infections, sanitized and reopened the schools, fairly efficiently. Secondly, we observe that there is collaborative response arrangements that have been set up with the Department of Health. And thirdly, that provinces have set up school-based support teams that are in the main made up of teachers or educators in the schools. In some provinces, those school-based support teams have been given refreshed training for them to be able to more effectively manage the emergence of these infections. We've also observed, as the DG has indicated, that the schools have adopted various models of schooling to accommodate social distancing, and in particular, I was specifically referring to the ordinary schools. In the main, 57.2 schools from those that we have visited had adopted daily rotation or alternative day approach, which meant that learners of a particular grade will come in an alternative day, and the second preferred or practiced provision is maintenance of the status quo. So maintenance of the status quo means that learners come to school every day, and that particularly applied to grade 7s and grade 12s, which were prioritized by the schools, and it also applied to small schools that had sufficient space to take on the learners. So, and the rest of the other approaches were used to a lesser extent, so platooning and weekly approaches. A different pattern emerges in respect to special schools, and I'm sure that's understandable. The mostly used approach in special schools, it's the full kind of old maintaining the status quo. And I'm sure we can understand why, because the learners, most of the learners that go to special schools have various disabilities that will require them to practice in this manner. And secondly, the second utilized is I didn't know that my challenge with reading gets this far, but you can see it for yourself. Age is knocking, but there it is on the screen. Next, we observe that overall challenges relating to the attendance and comorbidities in schools were low in most of the schools. So it's a very complicated slide to read, and I'll help you read that. So what that says is that, for instance, the percentage of teachers who did not return to the schools were under 20% in most of the cases. So they were under 20% in 91% of the cases. So which means that actually there were very, very few instances where teachers did not come back. Absenteeism as well takes the same pattern. What was slightly different, very slight, is the percentage of parents of learners from grade 7 and 12 that have kept their children at home. You can see that the 81 to 100% was slightly bigger, but there too, it was small, slightly pronounced. What is more pronounced is that in 71% of the cases, under 20% of the learners did not come to school. So in general, those the return to schools was quite positive and overwhelming across the country. The large cases of comorbidities, complicate the planning in schools. So the number of, educators with comorbidities in particular, complicates timetabling in schools, and this was picked up in our conversations with school principals. So from this planning analysis that we looked at national and provincial level, we got a sense that planning for social distancing and optimum learning became more complex as more grades were earmarked to return to schools, where the physical space is inelastic. And physical space is inelastic in that you can't extend it, you can't change it in a day. And even if the department was to go and get extra classes and so on, it's going to take more time to get those extra classes in place, temporary classes and so on. So that's what the elasticity there refers to. And lastly, the number of available teachers, reduced number of available teachers due to comorbidities made timetabling, complex. So from the plans, that became very clear. So what have we seen or heard from the schools? Walking in the corridors of the schools, we noted that the first time we looked at the data, on the first, we noted that 58% of the schools were actually saying they were not ready, and that actually came down somewhat by the time we analyzed the next set of data. And you can see which provinces contributed to the number of schools that said they were not ready. A bigger proportion of that was from the Eastern Cape, and somewhat from Limpopo, and to some extent from Kwazulu Natal. And those happens to be our largest provinces. So the larger numbers there tend to influence the national picture. But we'll soon see what were the reason for them saying that they were not ready to reopen. However, I must indicate that when we get to the end, you'll see that some of those reasons that were cited were actually sorted out by the 3rd of July, when we went back to analyze all the data. Most of the referred reasons by Wednesday the 1st were around lack of PPEs, and you remember those provinces that were high contributors to the non-readiness of the schools, and those were still busy distributing PPEs. The next one was inadequate measures to reorganize learning. So the complexity of reorganizing the allocation of teachers and maintaining a lower learner classroom ratio and lower teacher ratio in the context where there are teachers who are staying at home because of comorbidities, and that was about 64%, followed by inadequacy of psychosocial support and lack of space for social distancing and lack of teachers to cover the classes. The rest of them were fairly small, and mind you, these were analyzed from 200 cases of the schools that amongst the schools that we have visited. Then we looked at practices relating to wearing of masks. It will mean less if we provided all the masks and the learners and the educators were not putting them on. In respect to ordinary schools, and I'm saying ordinary schools because we include both public and private schools in those ordinary schools. So you can see that majority of the teachers are wearing the masks and they are washing their hands. And the same applies to support staff. But our learners, lesser proportion of our learners are wearing the masks and washing their hands. If the reports, in fact, if the cases that we've seen actually, and the reporting by the principals is to go by. In special schools, as you will understand, there's much lesser number of learners who are putting on those masks and are washing their hands. And in fact, we associate that with the levels of disability in special schools. Another feature that we looked at is parents who are keeping learners at home. In ordinary schools, the first time we analyzed the data, 45% of the principals indicated that there are some parents who are keeping their learners at school. When we analyzed the bigger proportion, finished the analysis of the data, that reporting came to 38%, of the principals reporting that households are keeping learners back at school. It gives us a feel of what we're dealing with out there. In terms of special school, there's a different pattern, and the latest analysis shows that 27% of the parents are reported to be, or the 27% of the reportees, which are principals, are indicating that some households are keeping the learners, back at home. And as I said, we took the time to have conversations with the principals. And those conversations, DG, were quite deep and I think, informative. And it's useful that we always use both quantitative and qualitative measures to understand what the schools are dealing with. And we think that these qualitative measures give us some depth and insights in respect to how the principals are dealing with the whole business of bringing back our kids to schools. So firstly, and we asked them questions around 5 areas, and I'll just give you highlights. There's a whole lot more data that we can share with you on that. The first one is around screening. So in general, screening in schools is happening quite well, and in fact the principals indicated that they are managing very well with the process of screening and their isolation rooms. They're doing the sanitization as required. They did flag the observation that some parents do not send their children to school with face masks. So even though the face masks have been provided, some kids forget them at home, and the request was for parents to please remind their learners to take their face masks as they go to schools. So they reported some thermometers that malfunction under very cold temperatures, and in some cases where teachers were not always able to follow the protocols. And the concern there is that there were cases where teachers, kind of took knee-jerk reactions, and when the temperature or there's some signs amongst learners, they will quickly send them away before they confirm. So it's important that protocols, for instance, are followed and confirmations are reached before those decisions are made. In respect to infrastructure and nutrition and the safety of learners, some of the highlights are very simple but very important innovations that schools are coming up with, such as barring the sharing of plates and spoons in relation to nutrition, and how they're managing tech shops. Where they're tech shops, we've established incidences where tech shops are operating on the basis of orders, or just they've closed the tech shops and urge the learners to bring lunch from home, and that social distancing is being observed in classrooms and in common areas. School reorganization, break time, interesting innovations there, and one can see how important it is. So learners are being observed, monitored by teachers during break times, and learners of different grades are actually asked to go on breaks or organized to go on breaks during different times to minimize the possibilities of undermining the social distancing principles. Grade 12s, in terms of school reorganization, we found that most of the schools actually expect the grade 12s to come to school every day. And that's for obvious reasons, prioritizing them for the matric exams. Psychosocial and community support. So we found that from these conversations that communities and the Department of Health and Social Development actually are working with some schools to respond to some of those psychosocial needs in schools. And perhaps it's important to say that psychosocial needs do not stop at school. So learners will go home with the psychosocial needs. So these psychosocial needs networks or support networks that are there outside the schools will have to jack up their engagement with communities to support learners to deal with the anxieties that the minister referred to earlier on. Some schools were provided with training on psychosocial support. In Gauteng in particular, they were given material to refresh their knowledge on psychosocial support. Lastly, we asked them questions on how they're ensuring optimum learning, because learners could be going to schools, but that's different from optimum learning. So a lot of things are happening in schools, and principals told us that some of their teachers have received orientation on the repackaged curriculum, so rechunked within the available time, and that they are battling with a insufficient teaching staff to manage the teacher-learner ratio. So that is just the nature of the reorganization of schools. It's causing serious teacher-learner ratios and classroom learner ratios. But plans are being made. And the last area we looked at is the tracking and verification of the provision of the protective essentials. And we collected data, updated that data up to the end of the 3rd of July. And I just need to indicate that the reduced number of grades, which the Council of Education Ministers decided on Thursday, and the continuous, added to that, the continuous distribution of this essential have actually improved the risk profile of the provinces across the country. Firstly, because it reduced the pressure on the provincial systems. So in terms of the number of masks and the spaces that have to be available immediately in schools, and just the readiness of the schools. So you can see, I don't plan to go through the entire slide here, but you can see the risk profiling, which is the last two colored blocks, that on the 1st of July, we had only 3 provinces that were flagged to be in the low risk category. 3 other provinces were in the medium risk category, and 2 were in the high risk category. And in the main, and one we could not make an opinion. In the main, the distribution of those essentials was the problem. Because we have reduced the number of grades, and because the provinces have continued to supply the essentials, that risk profiling has changed quite significantly, wherein we had by the end of yesterday, after considering the data from Friday, 5 provinces that were in the low risk category, no province in the high risk category, and the remainder of the 4 provinces in the medium risk category. There's the first graph there, shows how the reduction of the grades has actually alleviated the pressure from the system in respect to the masks, and not in respect to hand sanitizers and hand soaps and disinfectants. But be it the case, we reached the following observations by Friday, which we expressed to the Council of Education Ministers. Firstly is our observation of a more confident system in terms of planning for the return of the next cohort of learners. We've seen that in all the levels down to the districts. And we think that the lessons that were learned in respect to the first cohort were quite useful and were taken into account. Secondly, we expressed concern to the DBE then on the basis of data that we collected by Wednesday about the pressure of returning all the target grades. And we also expressed concern about the state of readiness in 5 provinces, as you would have seen in my previous slide. And we alerted DBE to pay attention to a number of aspects which were pulling down the risk profiling. That included masks, incidents management in schools, variation of timetabling provisions in provinces and districts, inadequacy of teachers, classrooms, ratios, and ensuring adequate levels of running water. And then we made recommendations specifically to try and achieve in a balanced manner the safety of our kids, the wellness of our kids, optimum learning in those schools, and sustained schooling in those schools. And these recommendations, one in the main, we recommended that CEM considered slowing down the process of returning the grades. Secondly, we recommended the standardization of timetables across the provinces and the districts. And then yesterday, we had a long discussion with the heads of education departments, and they were able to express and make us understand why the variation in the timetabling, for schooling. And essentially, that seeks to allow the schools to independently read their own situations and to choose the best suitable approach to them. Some of them are best suited by platooning, particularly if they are small schools, and others will go for weekly rotations if they are large schools and that sort of thing. So I think it's important for the public to understand that. Fourthly, that working with the Department of Health to introduce, we recommended working with the Department of Health to introduce fairly simple, common, standardized set of incidents management protocols across the country schooling system. And lastly, exploring an integrated water provisioning strategy with the relevant departments and spheres of government. In particular, we refer to the Water Affairs and Forestry Department and local government. We made that recommendation because provision of water in schools in the context where communities don't have water, communities just simply come and share the water. So therefore, it requires an integrated strategy. And we're happy to learn that DG has been moving with discussions with his counterparts. And lastly, and the final observations, which we updated since we updated since we collected additional information, and since the number of grades that are expected on Monday have been reduced, in fact, which brought down the pressure. As I said, we're standing yesterday with 0 provinces that are in the high risk category. We had 4 provinces which were in the medium risk, category: Kwazulu Natal, Mpumalanga, Limpopo, and Northwest, and I'll come back to that, and 5 provinces that were in the low risk category. And I must indicate that from yesterday, we've been receiving further confirmations from the provinces on the deliveries that were being made by the provinces to the schools, and largely from the warehouses and the circuits. We unfortunately could not update, process all that information and update the risk profiling. So we acknowledge, that the risk profiling as at where we stand would have improved, quite significantly, and we welcome CEM's a decision on Thursday to adjust, provide for flexibility in how different provinces and could go about, and districts could go about, managing the return of the various grades. Minister and DG, that marks the whole of our presentation. Thank you very much.
Thank you so much, Baba Khosa Councillor Sunene. Minister, we've got to that point where I will be asking MECs to make their inputs. I will be starting with the MEC of Education in Kwazulu Natal. I hope that MEC Mshegu is ready, and we will also be going to the MEC of Free State thereafter. In fact, I think that I must just start with the MEC of Free State. He looks more ready than the MEC of KwaZulu Natal from what my screen is showing me here. MEC Mshegu, I'll come to you after MEC Tate. MEC Tate, you are on the floor. I'm going to ask you to make your input, and in about 3 or 4 minutes, tell us about the current state of affairs in the Free State Province. Over to you, MEC.
Thank you very much, Elijah. Thank you very much, Minister and colleagues. I think the report of the NECT really has covered most of the issues that we wanted to talk about. But I can confirm that in the province, the very fact that the past almost a month, we've been having grade 7 and grade 12 in schools. We can confirm that our systems were tested our alliance or working relationship with the Department of Health was tested, and therefore we believe that we are ready for more grades. I also need to use this opportunity to thank the CEM for understanding that we should not take all the learners all at once, but it would be better for us to take to break up these grades, and then therefore we are ready to take grade 6 and grade 7. Grades 6 and grade 11, and then we have also indicated that where schools are ready, we will take grade 3s. The biggest issue about grade R, sorry. The biggest issue about grade R is that there's a lot of anxiety, amongst the parents, people being worried about their bundles of joy that they may be affected. But if you look at the experience we have now, all the COVID cases that we have had up to so far, they only came out from the high schools. And then our health system has been able to address some of those issues. So from our side, we think we are absolutely ready. And therefore, I would not want to waste a lot more time to cover what NCT has covered. Thank you.
Thank you, MEC, Free State. I'm now going to ask the MEC in Kwazulu Natal to address us. MEC Mshego.
Thanks, Elijah, and greetings to the Minister, Deputy Minister, and the public at large. Well, from KZN, we've been really working to better the system since we opened for grade 12 and grade 7. There are a number of lessons that we have learned and experiences. None of our school has not opened. Obviously, there are some schools in the province where it has really been stop and go because of wild infections that continue to be recorded, but also the issue of water and the erratic provision of water in our schools remain a challenge. And there are instances where communities are helping themselves with the water in our schools, but also the capacity of municipalities to provide water according to our schedule and timelines is really limited. We are working hard with COC and municipalities together with the National Department to try and complement the capacity of the provision of water, because the major threat really in all our schools is the issue of water, one, but now the rising infections are also posing a challenge. As at yesterday, we recorded 429 infections recorded, 306 being educators, 81 learners, and the rest being the combination of food handlers, security guards, as well as other office-based workers in our schools. 345 schools were affected. Of that, 236 have been decontaminated and opened. 70 will be opening tomorrow, and then the remainder will be opened by Wednesday. Insofar as the return of grade 11 and grade 6, we have prepared as a province. Last time we did report that insofar as COVID-19 essentials, we procured for a stock that will be able to last us for a period of 6 months. But we needed to add masks for the returning grades. I do need to indicate that we started delivery of masks on Friday, yesterday, as well as today. Most of the districts will be completing or should have completed by now the delivery of masks. Where there will be isolated schools left, definitely by tomorrow, they will be getting those masks for grade 11s and grade 6. There are 2 districts that are being disrupted by criminals who call themselves business people and have organized themselves into business forums. And these are people who are extorting or are attempting to extort government. They've blockaded warehouses where these PPEs have been stored, and they are threatening to attack those who have been given work to deliver PPEs to our schools. We have worked with the police as well as the SNDF to get reinforcement, so that we really send a strong message from government side that will not allow anyone to undermine the authority of government or to risk the future of our kids. I mean, these are so-called business people who, when the opportunity was given to tender and procure these PPEs, they did not follow the process. They are relying on criminal acts that they will go to warehouses and all of these things and threaten people to say, if you don't give us the percentage of this work, we are going to deal with you. Or if you don't want to give us percentage of this work, give us the percentage of your profit. And that's how they're operating. And that's why I was saying these are not business people, but thugs who are masquerading as business people and want to send a strong message from government that there will be no one tomorrow who will be disrupting delivery of PPEs to schools. But we also want to call on genuine, credible business people to rise against this phenomenon, which is threatening to spread across the province. But in short, we are ready to accept grade 11 and grade 6 tomorrow. We'll continue, obviously, with the guidance of the minister to prepare for the return of grade R and other grades, and that will be communicated as and when decisions insofar as that are taken. Thank you.
Thank you, MEC KZN. I'm now going to move to the MEC of Education in Gauteng, MEC Banyaza Lusufi, who has a presentation which we are going to project now on the screen. I hope MEC Lusufi, you're ready where you are. Lusufi, please indicate to me so we can start with your presentation.
Thank you so much, Elijah. I'm indeed ready. I'm not going to be long. We'll just run through the presentation quickly, just to summarize the issues that are there. I think my colleagues, both from Free State and KZN, represented as well as the report coming from the NECT. So if you have the presentation, we can take it quickly so that we can be in a position to run it as fast as possible.
We're ready, let's go.
Thank you so much. I think firstly, the most important aspect that we want to put, to indicate is that we are running a motto that says safety first. Everything must be safe, and ensuring that everything is safe, we must ensure that the PPEs are in our schools, there is screening, there is social distancing, and schools must be cleaned thoroughly, there must be water, and toilet facilities must be in good standing. You will see in the next slide that we are taking through our toolbox. These are the things that we believe are non-negotiable, that there must be social distancing, there must be lockdown, there must be proper hygiene practice, and that those that have symptoms must be isolated immediately, that every learner must have a cloth mask, and they must practice cough etiquette, and there must be testing, isolation, and frequent environmental cleaning. This is very important because it gives us an idea of the situation within our school premises. We want to move quickly to the resumption of learning and teaching. I think our colleagues have covered that aspect, that all our schools were provided with reorganized annual teaching plans, and there was mediation, and we reorganized all our plans, and all our schools were supplied with necessary tools so that they can practice the Zoom software, and we also gave them the PowerPoint presentations. We recruited novice teachers. These are young teachers that have just graduated. We're giving them support because we really believe we're going to experience a shortage of teachers, especially those with comorbidities and those teachers that have reached the age of 60. We will see in our next slides that we've got views on how to manage that particular aspect. We have arranged additional support, especially for those learners that have not been part of the off-season education. You will see that we've arranged Saturday schools and Sunday schools, and also managed to organize that each and every parent get the necessary material. We want to thank our partners, especially the SABC and other TV channels that have come on board and provided free lessons plans, and those institutions that have managed to give us lessons plans that learners are following through various channels and various platforms. We just want to emphasize that we have indeed strengthened our home education. It's a very important. I think there are lots of parents that believe that they can't bring their children back at school, and therefore we felt we needed to give them the necessary support. So we've received application for home education. What we've done, within a 14-day learning cycle, we're giving parents the material or the work that learners must attend to on the basis that they cannot bring their children within our school premises. You will see our remote education programs includes learning topics, summarizing of topics, step-by-step guidelines for tutoring, assessment task, memorandum, zero-rated electronic media educational programs, so that all these learners can be provided with the relevant support. But we want to emphasize that the application for home education must be done through our website, and within 7 days, we'll be in a position to respond whether your child can be in a position to get home education or not. If you move to the next slide, Elijah, you will see we are summarizing attendance per region in our areas to say how many schools were affected by lower learner attendance and how many schools were affected by lower education attendance. You'll see in Ekurhuleni, out of 494 schools, only 27 schools had lower learner attendance, and only 11 schools have lower educator attendance. The hardest hit area was Johannesburg. Out of the 700 schools, only 84 schools had lower learner attendance, with 9 schools having lower educator attendance. In terms of infrastructure, we've just moved. We had schools that we had 67 schools that started on the 4th of June without proper water supply and sanitation. We can confirm that all those schools now have water supply. Here it's mainly the problem of Eskom in our province, mainly because the schools are using electricity for water pressure. So if there is or the challenges of electricity, the water pressure will be low. We had 351 schools that were affected by vandalism, but all those schools have assigned contractors who have gone there to fix the problem. So if you check progress in terms of vandalized schools in the next slide, Elijah, you will see that there were 76 schools in Ekurhuleni. 74 of them already have contractors. And if you go to Tshwane, you'll see that 72 schools and 59 of them already have contractors. So we had a total of 351 schools that were vandalized. 380 of them have contractors that are fixing the problem. We want to take through the comorbidities is a serious limitation of problems with the number of both learners and educators applying. We want to take you through the statistics across all our regions in our province. You will see that in the area of, in total, the number of teachers that have applied to say they've got underlying diseases, they cannot come back to teach. It's 2,121, and that's a huge number if you take into consideration the total teacher population. And in terms of staff members, that is people that are working in our offices, we've got 199 people that have made those applications. You will see the total number of applications that we have already approved is 94. If you take into consideration the number of people that have applied, you can see that it's a drop in an ocean. It's something that we're working very hard on. We really believe that we'll push and resolve this matter. We welcome the statement made by the minister that we need to move with speed in resolving this matter. If you come to educators, you will see schools with less than 5% learner applications. There are 406, so we've got 406 learners that says that they can't come back to school because they've got underlying diseases. Those that are between 6 and 10%, it's only 9 learners that have made that application. And those that with more than 10% learner applications is only 5 schools. So in total, just around 420 or so learners believe that they cannot be in a position to be in our schools. If you go to the COVID infection, I think the minister gave a nice national summary. but we can summarize our provincial position. You will see the total number of affected schools in Gauteng is 571. These are the schools that are affected by COVID. Of those 571, we've got 151 learners that tested positive. We've got 519 educators that tested positive. We also have 572 admin staff that tested positive, and those that are general assistants that are assisting us in the gardening or cleaning of schools. We've got 18 staff members that tested positive. We also have youth brigades. These are the people that are doing the screening, and I want to thank all of them because they're sacrificing for us to have a safer environment. This is the first line of defense. Unfortunately, we've got 7 COVID brigades that tested positive. So we've got a total of 735 staff members that tested positive because of COVID. This affecting 120 schools that were closed, but majority of those schools are already open. You'll see if you go to the ages of our educators, we've got 3,699 educators that are above 16, which simply means that we need to replace them. Of the 3,699, 2,179 primary schools, 1,194 that are in secondary school, and we've got 389 that are in special schools. This, if you combine this figure and the figure of teachers that have applied for comorbidities, you will see that we've got almost 6,000 educators that might not be with us in a long term. So that's the reason why we have gone out to recruit young, dynamic teachers to join us here in Gauteng. I'm not going to go through the engineering of schools. I think the minister covered that aspect very well. We just want to assure parents, if there's a slide about the provincial deaths, age and gender breakdown. If you go to that slide quickly, Elijah, it's provincial deaths, age and gender breakdown. We just want to assure parents that thus far, we don't have casualties in Gauteng in terms of underage people that have died because of the COVID disease. You'll see from the ages of 0 to 9, Elijah, if you can run to that slide, you'll see from the ages of 0 to 9, we only have 0 deaths up until the ages of 19. So we really believe that with the expert guiding us on this matter, we'll be in a position to manage this issue appropriately. But our premier is approaching the National Coronavirus Command Center. We really believe that our figures are galloping. I think the presentation by the DG as well as the presentation by the NECT indicates that we're having those kind of challenges in our province. So we're expecting 1,224 learners that are coming within grade R, and 212,000 that are coming grade 6, and 159,000 that are coming from grade 11. So if you check the current numbers that we have, 180,000 in grade 7 and 106,000 in grade 12, you will see that this is a huge task that we have managed to execute. We've already delivered all the PPEs for all the sectors. So wherever we are, we really believe we'll be ready for tomorrow to welcome all the grades that are coming, that is the grade 6 and the grade 11s. And we really believe they will have all their PPEs. We've given the delivery schedule of each and every district. And on the basis of this, we really believe that we'll welcome all the learners that are coming. As I've earlier indicated, the virus in Gauteng is ravaging our communities. We need to be very careful, and that is why our premier is approaching the National Coronavirus Command Center to put strict proposals that we really believe will assist us here in Gauteng. And we really believe with that presentation, it will give us an idea what will be the role of the education sector in that process. I want to leave it there, Elijah. Thank you so much for your attention. Truly appreciate it. Thank you.
Thank you so much, MSc Lusufi. We really appreciate that presentation, and there's a lot of detail in it. So there's a request that we please upload it and make it available on the website of the provincial government, so that people can be able to access it and see what's in it. It's quite informative, and we really appreciate that. I'm going to now ask the MEC of the Northwest to please make your input. MEC Matimela.
Thank you very much for affording us a space as a Department of Education in the Northwest Province. I want to say, firstly, let me greet all who's here today, the Minister, Deputy Minister, and all who's here. I want to say, or to start by saying, the brief of the Minister have indeed covered the space because it is been informed by all the provinces in South Africa. Therefore, I think the brief on its own have touched on a number of issues that we have even discussed on Thursday. The other issue, I cannot overemphasize what has been said by NECT as one of our people that are doing oversight. I really appreciate the good work that they continue to do. The honesty in their reports is highly appreciated. Importantly, I want to say to our stakeholders in the Northwest Province, thank you very much. You have been keeping us to our toes as a Department of Education. We have been listening to you. We have worked together. We have corrected our mistakes as the Department of Education because indeed we want to emerge as overcomers at the end. I want to also say my thanks goes to social development in the Northwest Province, the Department of Health, and also SANDAF. They have assisted us a lot in the province. We are receiving 96 learners, including the grade R's. However, there will be delays in certain schools because we need to bring all our learners in our different schools and be sure that our learners are more safer in our schools in the Northwest Province. I want to also say today, as we are here as a sector, the Minister is busy unfolding the plan of us as a sector, because what we have talked about within the plan included the issue of water and sanitation, included the issue of human resource, included the issue of COVID-19 essential, etc. So we will, in the Northwest Province, continue to unfold the plan that we have agreed about as a sector. And I want to conclude by saying we are indeed receiving learners tomorrow. However, there are already people in the Northwest Province who really want to disrupt the coming of other grades in our schools, because we are not reopening our schools, but we are facing in other grades. I want to humbly request the people of the Northwest and everyone who is planning to disrupt the coming of other faces in our different schools that afford us a space, a chance as the Northwest Province, so that our teachers in our different schools can continue to develop learners in different areas as per the ATPs. Thank you so much.
Thank you so much, MEC Northwest. We appreciate your presentation. I'm now going to go to the Western Cape and ask MEC Motshekga to take us through her input. MEC?
Thank you very much, Elijah, and good evening to everybody. Since we have opened, I can say that we have not seen evidence of spread of the virus within schools. That is out of keeping with the infections in communities. The number of active infections in the Western Cape now is no longer the highest, and our daily infections, as at the 4th of July, are in fact the third in the country. We have just under 2/3 of Western Cape schools have not, in fact, reported any cases at all of COVID-19 at their school. And of those that have, 81% have only reported one case, or one or two, cases. So the vast majority are not reporting infections at this stage. The confirmed cases account for a very small percentage of those at schools, 0.1% of learners, and that are back in grade 7 and 12 so far, and just under 2% of our staff. As far as school closures go, we've had on average about 20 schools closed per day out of our 1,509 schools. Those are not even all COVID related. Some of those are because of community protest actions. We are very quick at addressing the issues of COVID cases in schools for decontamination purposes. As far as the preparations for receiving more learners are concerned, we have delivered all the required PPEs, sanitizing materials, masks, and thermometers. Additional deliveries were made last week. It's also important to note that, contrary to the views that some people keep on trying to spread, that not all learners are going to be at school every day because of the way that our schools have devised their temporary revised education plan. So the way that they are going to be functioning is by amending their timetable, rotating. They're going to make sure that teachers remain in classrooms. They're going to look at the available accommodation, learner numbers, and teacher resources to decide on the modality of the curriculum application. They're going to stagger intervals, and of course, they're going to allow for variations such as taking one grade on different grades on different days, or maybe only half a class per day. So we will not be compromising on the physical distancing requirements of 1.5 meters at all. Schools, in terms of the regulations, are still allowed to welcome back more grades than those that have been discussed up to now. So we will be ready to welcome our grade Rs, our grade 6s, and our grade 11s tomorrow, as we have the Minister announced on Thursday. We are able to proceed with that, and will do so. There are schools that have already brought back more grades, and they will be allowed to continue with that. And if schools are wanting and able to bring back more grades even than that, they are allowed to do so in terms of the Minister's regulations. They have to just inform the HOD, and we can do inspections to make sure that they are complying with the protocols. We have various learner concession options for parents who are any learner who has comorbidity can apply for a temporary exemption from school attendance. Any learner whose parents just want to keep them at home for reasons of anxiety are able at the moment to apply for a temporary conditional exemption. Also, through their school, they must fill in a form and hand it in to their principal, who will then forward it to the HOD. And the third option is for home education formally, where learners may be deregistered from our school. Staff with comorbidities, we've received approximately 2,300 applications and approved over 1,700 so far, so that is a concern. And what we are telling our schools is that anyone who has a comorbidity or falls ill or has to isolate, the school can apply for a substitute. And we have also asked anyone who has an interest in teaching and is studying for or has completed an education degree to apply to be a temporary classroom assistant, to help the teachers with comorbidities who may be working from home to at least manage their classrooms when they are not there. That can be accessed on our website, on our e-recruitment system. But we are ready to go. I also want to reiterate that we have had a number of community disruptions and threats to continue doing so, and I would also like to appeal to people to stop intimidating our staff and our learners. If they do not wish their children to go to school, they have options to keep them home. So, and I just want to thank our law enforcement authorities who have also unfortunately had to step in over the last week. But we are ready, and grade R, 6s and 11s will be welcomed at our schools, all of our schools, tomorrow. Thank you.
Thank you, MEC Western Cape. We appreciate that presentation. I'm now going to ask the MEC of Mpumalanga to have his say. MEC Majuba, please proceed.
Thank you, Elijah, and good evening to the minister, and good evening to all who are listening. What we can say is, as I was listening to the DG, he alluded to the fact that we are at the state of vigilance in Mpumalanga. And thanks to the command council that is led by the premier in the province for the good work that is done, that we are not at a much danger position. But we are trying our level best to work very hard because we don't want to be complacent irrespective of the situation we find ourselves being in. That is why we are working very hard and make sure that we avoid any form of further infection that we might find. We expected more than 600,000 learners, but due to what was discussed, we had to reduce those learners to 248,181 learners. As a result of that, because we expected more than 600,000, in terms of all the hygienic packs, we have managed to say that we are quite ready. All learners will be protected when it comes to hygienic packs. When it comes to the question of those schools which were infected, in the province we've got 42 schools which were affected. Out of 42 schools, we've got 43 teachers and 15 learners, 9 non-teaching staff members. We can say that our greatest challenge that we have as a province, because we are in a rural situation. Our greatest challenge is the question of sanitation in our schools with pit latrines which are there, and also the question of water. And we can say that we have managed to mitigate to a greater extent when it comes to that, as according to the NECT report. We do have challenges there and there, and we are working very hard to deal with those challenges. As we are expecting learners to come, will be phasing in the province, grade 6 and grade 7. But we also allow those who will be ready to phase in grade R, so as they can be able to allow the grade R also to come in. Those schools which do not have a capacity to phase in grade R, we said that we will work with them to make sure that as speedily as possible, grade R is also phased in. But we will make sure that we monitor, especially the phasing in of grade R, to make sure that phasing in is as close to perfection as possible. Those are the issues which we want to deal, because most of the issues were raised by NECT, and we believe that the NECT and the DG and the minister, they did present correctly for us. Thank you very much.
Langa, I am now going to the Northern Cape to ask MEC Jack to have his say. MEC, over to you.
Thanks, Elijah. Thanks also to the Minister, Deputy Minister, and my colleagues. Briefly, as the Northern Cape, we are indeed ready to welcome something like an additional 40,596 kids. That is now grade 6 and grade 11. As we welcome them, they are going to be joining your grade 7s and grade 12s, which gives us an average of 28.4% of the learner population of the Northern Cape, which then means, as we are saying, when it comes to grade R, we are going to delay the start of grade R with a week towards next week, Monday, which is the 13th, we'll be welcoming the grade R's. Tomorrow, it's only grade 6 and grade 11. On top of that, as the Northern Cape, we learned from the previous intake, which was on the 8th of June, to ensure then that we are having all our hygiene packs, we are having running water, we are having our masks and everything that goes with it ready at the schools. And as a result, it was not a challenge for us to have all these items ready for tomorrow. So we are indeed ready as the Northern Cape. If there's one aspect that I would like to underline is the fact that our teachers, the level of comorbidities are quite high, and as a matter of fact, we are going to be struggling with the subsequent grades after tomorrow with the number of teachers, but we are also trying to work out plans and solutions. And on top of that, we are only having 0.7 schools from the previous cohort that could not start, that is now 4 primary schools, because it's precisely what we are saying. A school is a reflection of the community. Obviously, if the infections are high in communities, there is going to be a challenge in terms of the schools. And also, if there's water challenges in communities, there's water challenges in schools as well. That's why then the 4 primary schools could not open, is because of water challenges that were there. Other than that, Northern Cape is combat ready to welcome our kids, and we also want to request the communities, as well as particularly the parents, to ensure that they are forming part of our plans to ensure that our kids remain safe and secured and health-wise in our premises. Thank you very much.
Thank you, MEC Northern Cape. I've been trying to find Eastern Cape. I've been informed that they are not on the line. So I'm going to take the last province in my list, which is Limpopo. I'm going to ask MEC Bushielo to please proceed with your presentation. MEC.
Thank you very much, Elijah, and good evening to Minister, Deputy Minister, my colleagues, and all the viewers at home. I think as Limpopo, we are ready for the coming grades tomorrow. We have decided that we are going to delay grade R until the 29th of July 2020. But those who are already at school, they must still continue. And those who are ready, they can still apply to the HOD for them to go on. But tomorrow, we're going to receive the grade 6, 128,832 learners, and the grade 11s, 119,665. As of today, we have distributed the following mass to district and circuit, 368,991 for learners for grade R6 and 11. So we have taken cloth mask, 2 per learner, 736,582. Thermometers we have delivered 7,422. Hand sanitizers we have delivered 184,146. In terms of mitigating for the loss of learning, our CAPS curriculum have been adjusted in terms of grade 12 curriculum, and then for the rest of the grades, we have trimmed them up. The SC and NSC examination have been meshed, and the adjusted curriculum set out have been revised in our annual teaching plans. We have 3 challenges, critical challenges: water and sanitation, COVID-19 essentials, and cleaners and screeners, which we have tried to deal with them. The emerging challenges are inconsistent in terms of the management of COVID-19 cases in our schools, and learner and educator absenteeism due to comorbidities and parents who choose not to bring their learners to school. How we are managing them? The schools are utilizing the standard operating procedure, and we are again workshopping our principals and SMTs and SGB and training them to understand it even better. We have delivered all of the SOPs to school, and also we are working closely with the Department of Health. In terms of also managing the comorbidities, in terms of educators, we're using the collective agreement number 1 of 2020, PSA employees, Public Service Act, and learners who have sent questionnaires to school to ask parents to give us, to tell us if the learners have underlying comorbidities. And up to so far, 117 learners have comorbidities. Non-teaching staff is 3. Educators applications that we have received is 935, and the concession granted is 499. Our plans in terms of making sure that we don't have gaps, we are utilizing our substitute post to fill the posts left vacant by educators, and then also district keep a register of unemployed qualified teachers, which they can use as and when they need them. In terms of also making sure that the learners at schools are still receiving their lessons, we're still continuing with our pre-recorded lessons in terms of radios and TVs, WhatsApp, and also e-learning in terms of our website. In terms of water and sanitation, is a battle that we are now seeing the result and winning up to so far. We have requested 523 tanks. Total delivered is 435. The remainder, which is 87, is because of the dry boreholes. And we're working with Department of COCTA, and our PCC are trying very hard to assist us in this regard. In terms of the toilets, we had 515 that needed toilets. DBE have delivered 455 to schools, and our own department, we have delivered 50. So all in all, we have delivered 506 toilets to all schools. The remaining ones are small challenges that we are busy dealing with. In terms of scholar transport, all our official routes ferry learners to school. New routes that will come because of learners coming in will be dealt with, but we are also already preparing for it. Social distancing are observed, and sanitizers for learners and disinfectants of buses or transport are done. In terms of the feeding, nutrition, we are feeding our learners and also feeding those who are not at our school. So as Limpopo, we are ready, but we are saying for grade 6 and grade 11, grade R should remain at home, and at the right time, they'll be able to come back. Thank you very much.
Thank you, MEC Bushielo. We appreciate that detailed presentation. I see MEC Eastern Cape has joined us. I'll try to get him to connect with us if the technology cooperates with me here. But colleagues, I'm told that the questions have since come through via the WhatsApp line, and we will be crossing over to Peliswa, who is on the line, as well as Ignatius, who will be reading the questions via WhatsApp. Please limit the questions to three questions per journalist, so that we're able to give others a chance. There's been an information overload today. We know that that could have also generated lots of questions, but please let's work together to make sure that we give others an opportunity to also pose their questions. The number for the questions has been distributed by GCIS to the media. It is for that reason that they are able to ask questions, because they've since come through. MEC Gade, I'm coming to you just now. I hope you are ready. Please give me your picture, if possible. I cannot see you, but I can see your initials. Yeah, I can see a bit of you over there, but please proceed with the presentation. Thank you.
No, thanks, thanks, Program Director. Thanks for the opportunity that has been granted to us. We apologize. We've got a plethora of sessions, of meetings right through the day. We would want to take the people of the province and the country into confidence that we have tried our level best in ensuring that we can be able to phase in other grades. But there are just 3 areas of focus that I think I would have to reflect on. One is that in terms of the protective clothing that should have been the requisite for any grade or any school to be reopened back, we have been able to secure the PPEs on the basis that our procurement plan that we have been using was a procurement plan that have covered almost all the grades that are coming in the previous cohort of the PPEs. And therefore, we don't have a challenge. We are at 100% ready on that one. We can be able to proceed with the protective clothing that is a requirement in terms of the grades that have to be phased in. 2, in terms of the 756 schools that required tanks and water for us, we have been able to also secure those tanks and install them, so there is no issue in relation to them. And what is of greatest challenge in the province, which I think is going to be a daunting nerve for all of us that would have to look into, is the issue of the social distancing. Because remember, once you talk social distancing in terms of the requirement of COVID regulation, you are talking of a duplication in terms of the grades and classes that would require us to be able to secure that. So that's the one area that is going to be a challenge for us moving forward. And hence we have proposed to the minister that would request a deviation in some of the processes as leading to the reopening of the grades, so that we have got our own special dispensation at the province. In particular, on the grade R phasing in, we have a challenge on that one. Would have made our submission to the minister that it will be strategic and wise that grade R be considered during the course of the end of the month, and also ensure that in relation to grade 6 as well, we be given a space, grade 6 and 3 and 11, we be given a space to phase in programmatically, not holistically as the CM has raised. The reason for that, Program Director, there is a rise of infection in the province, and the rise of deaths of teachers and the rise of death of the learners. Now we have find ourselves being busy managing the infections and managing the health-related matters, not managing the pedagogy of teaching and learning, which is a constitutional mandate of the sector. And therefore, on the basis of that, the provincial government have made a request that there should be a relaxation to some of the grades that are coming, so that we can be able to flatten the curve in terms of the infections in the province, and not become a slaughterhouse for the people of the province, whilst we respect the national decisions that have been taken. That's how far we have gone. But in terms of the comorbidities, the LRC was instructed to sit on Thursday last week, so that we can be able to regulate that particular environment and be able to secure an understanding on what then becomes a mood of operandi in that particular space, so that we don't have conflicts with the labor in the context of managing the human resource that comes into our institutions. It is a fact. It is a fact that principals in the province have a high concentration of pressure and a high concentration of stress in relating to the management of the institutions, because there are many of people that have been reported as sick, and therefore we have to create a buffet for us to ensure that we are able to appoint assistant teachers in that regard. So summarily, that's what I can say, Program Director. I would entertain questions if there are any.
Thank you, MEC. There's lots of questions, I can promise you that much. I've been told by my colleagues here that we have lots and lots of questions, and we're not going to waste any time. Thanks, MEC. Minister, it's time for questions now, and I'm told that you will be able to answer questions from where you are. DG, Mr. Kosa, you can answer questions from where you're seated. All that you need to do is to turn on your microphone. But now I'm going to start with Peliswa on the telephone line. Do we have any question there?
Yes, we do. Natasha from SABC.
Natasha, please proceed.
Hi, Elijah, how are you?
I'm fine, Natasha. Please proceed.
Good. Hi, Minister. Sorry, it's Natasha here from SABC News. So, Minister, there's a statement that you made here that seems to be causing a furor on social media. You said that your ministry doesn't currently have any data or dates for infection and the confirmed numbers of COVID-19 infections amongst teachers or learners in South Africa. And parents are actually worried about this statement. I mean, how do you know that schools won't be the epicenter of, COVID-19? And of course, also, this doesn't inspire confidence amongst them. And then secondly, if Gauteng goes ahead with its proposed hard lockdown, I mean, how will this decision affect the reopening of schools? Thank you.
All right. Thank you, Natasha. Any other question, Peliswa?
I have another SABC, Mercedes Besant.
Mercedes, please proceed.
Okay. Thank you very much. I have three questions. One for the MEC of the Western Cape, the Northern Cape, and the Minister. The MEC, Debbie Schaefer, I hear you saying you're having less daily infections. Yes, you do. But from a school point of view, I would like to know how many teachers and learners have tested positive so far in the Western Cape. How many are from the private schools and how many are from public schools? How many learners and how many teachers are in hospital due to COVID-19? And what is the total number of schools, that had to close or schools that were affected due to COVID-19? And lastly, what is your response? I heard you touch about this thing earlier on, but what is your response to the EUSA Western Cape calling for Western Cape schools stay away? What can we actually expect tomorrow? The second one is to MEC Motshekga. I would want to know how many schools have recently closed due to COVID-19 in the Northern Cape and where. I heard you talking about 28.4 school population. What does that mean in simple terms, in terms of school learners? Is it 5, 10, 20? What does 28.4 mean? How many learners and teachers tested positive in the province? And lastly, there are some parents who are complaining that the private scholar transport, has increased dramatically. And these are learners who are, in public schools and from poor backgrounds. And some of their grandparents who get social grant have to pay for their learner transport. They used to pay 500 rand and now they have to cough up about 1,000 rand. What are you going to do about it? How are you going to intervene? Because you know that the Northern Cape is the province where you have people who depend mostly on social grants. So this means that some of the learners already, grade 12 and grade 7, they are unable to go to school because of the exorbitant from 500 to 1,000 rand. And these are for learners who are only going 2 to 3 days per week to school, and they have to cough up for transport of 1,000. Lastly, the minister, when you recently briefed the NCOP, the previous week, you indicated that you are investigating questionable medical certificates of teachers who declared comorbidities with some doctors. You also told the NCOP, I was doing the story at that time, you also told them that some doctors are calling you and complaining that some teachers are pressurizing them to ensure that they let them stay away, by giving them those certificates for comorbidities. But SATU, I called SATU and I asked SATU, and SATU says they shouldn't be calling the minister. They know their ethical bodies they should call, and they should actually refuse, but not to call you. But my question still is to you is this one question is that how far is the investigation on the alleged questionable medical certificates of those teachers, doctor teachers, and also are some of these doctors still calling the ministry about patients who are actually pressurizing them to give them medical certificates. And this is after you appeared in the NCOP. Have you had more calls from doctors?
Those long questions. Do we have any other question on the telephone line, please, or should I go to the WhatsApp?
Chair, you can proceed to WhatsApp.
Thank you so much.
All right.
Ignatius is even closer to me. You are somewhere in a room, somewhere behind the class, but Ignatius is just here. Please proceed, Ignatius.
Thank you, Mr. Mhlanga. I have Nazir from Glow TV. He's got two questions. He says there are many schools where the majority of learners rely on taxis. Given that taxi drivers have stated that they would not adhere to the rule of 70% passenger load, how is your department addressing the issue? The second question is, what is the police intelligence report on the hundreds of schools that are being vandalized? Is it merely criminal elements or organized crime syndicates behind these attacks? I have Isaac Mahlangu from Sowetan. How much has the department spent on PPEs so far? Second question, what is the progress in the schools that were vandalized during the lockdown? Have alternative means made for all affected schools nationally, and what are those? It's got another question. With more than 10,000 teachers going to work from home, how many new teachers have been hired or brought in as a result? I have Matthew from Times Live. Minister, you state in your address, open quote, what is critically important is that all grade R's and pre-grade R learners who have already returned to school must remain in schools, and those schools that meet the health, safety, and social distancing protocols can reopen for their grade R and pre-grades R learners. Will these schools have to make new applications to open, or if they had been given prior approval, will these approvals still be accepted and they can open as planned? I have Khumuto from Eyewitness News. Having seen the number of schools forced to close due to the spread of COVID-19, what are some of the mistakes that you have identified during the first phase that you will not repeat during this second phase? Second question from Khumuto. We have learned of schools in Mpumalanga which are accepting learners of all grades from tomorrow. Will there be any repercussions for this? I have Griselda Louise from SABC.
Let's make that the last one in this round.
What are the consequences for parents and their kids who are not comfortable in sending their kids back to school at this time? The last question from Griselda. Is there a realistic teaching and learning taking place during this period, when teachers are concentrating on maintaining health and safety standards during lessons? Thank you, Mr. Mhlanga.
All right, thank you so much. Let's pause right there for now. I'm going to ask the minister to go first with the responses to the questions, and then later on I'll be crossing over to the MECs to respond. MEC, Western Cape and Northern Cape. I think there are questions that were directly implicating you. So we'll be coming to you, but for now I'm going to hand over to the Minister. Minister?
No, thank you very much, Elijah. Let me start off on the matter of exams, which I forgot to mention in my statement, that because of loss of time and days, we have been really looking around assessment to say how are we going to assess even the internal grades with continuous loss of time. But with matriculants, during the CM meeting, we agreed to move exams from the normal start October. So they are going to start on the date
On the 9th of November.
on the 9th of November instead of October, and then finish around the 22nd of December. And marking will only start in January. And we are in communication with Minister of Higher Education for those who really wish to register to make sure that they will be accommodated. So I thought I should report on that one. The anxiety about, or the truth about the fact that I said of the cases that were detected to be positive in schools, there's no evidence that the infections happened in schools. But the truth of the matter is, as the Department of Education, after we've detected, because people get tested by health after screening, they receive the results from health, and health does the contact and the tracing of contacts. So it's that information does not reside with us. That's the point I was making. But we're saying, and that's what the MEC of Western Cape was saying, from the evidence we have, we don't have any concrete evidence to say those infections would have happened in schools. But without having that information that health has, I can't have a blanket statement to say it didn't. So that's the point I was trying to make. Because even when we're looking at the number of teachers who really succumbed to COVID-19, I wanted to check when were they sick, just even in terms of people who are colleagues. And we're told that the majority of them were not even able to report in schools. To report when we opened, even the learners that had, the 3 learners were not able to report because they would have been infected in communities. So what I didn't want to do is to do a blanket statement and say no one was infected in schools. But I'm saying of all the infections that we have detected, the numbers that we are saying, there's no evidence that it happened in school. But because we don't collect that information ourselves, it's information that resides in health, we're not able to really honestly pronounce that it definitely didn't happen in schools. That's the point I was making. About the difficulties around, there was lots of, and that's why we spent lots of time when we're in the CM around comorbidities. Because possibly one, there was just misunderstanding of the regulations, the different applications of the regulations, and the delay in responding to the applications. Yes, indeed, in an environment like this, why would I lie to NCOP and say, I didn't mislead NCOP and say there were doctors who really were, and not only to myself, even to MECs, to say, streamline and clarify this thing about comorbidity, because we're under pressure. Some of your teachers, even when we say, in terms of what is in the regulations, that you are supposed, if you are diabetic, it's not automatic that you are diabetic, therefore I have to give you a letter and say you can't go to work. It must be unmanaged diabetes. So saying that we are under pressure from your teachers. And we spent lots of time as MECs to say we have to strengthen, regulate, and that's why most MECs spoke about it. Because, and even MEC Gade says the ELRC has referred to it. So Satu is right. So if colleagues phone me, I can't say don't phone me. So we have to refer it to the right body to say, ELRC, we've been receiving this report. So I won't do the investigation, but it's not even information that should come to me. But if it comes, yes, it highlights the fact that there are weaknesses maybe in terms of the interpretation of those regulations. So the MECs were told so that in the councils in provinces, they highlight the fact that there's there are challenges about the interpretation of the regulations. The other one about vandalized schools, what we receive from the reports, often from provinces, it's a mixed bag of what we assume as problems around vandalism. In some instances, they come and break. When I went to the schooling in the East End, removing the metals. So even if you have a plastic tamp, as long as there's some metal, so you can see it's petty criminality. In some instances, people just come in, kick around your toilet seats and other things, so they don't take anything, they break. In some instances, they would have been targeting centers which have resources like your ICT centers. During the lockdown, sometimes the attacks were they were attacking centers where we had kept food that we left before the schools closed. So from the report, it's a variety. It could, and we still not definite. I think the matters go to court. So there have been cases where police have arrested people, so we'll get the real. So what we're doing is to really interpret what we see, that it's petty criminality, it's targeting resources, but in some instances, as I say, like the schools that were banned in Northwest with the tires, you're not sure whether it's, which we sometimes suffer from when there is unhappiness in communities, it gets taken out to schools. But the real reasons I think we'll get when some of these cases go to court. On the prices, maybe provinces will come, because we don't procure the PPs. The PPs, different provinces procure PPs through different methods. In some provinces, they do it through their treasury. In most provinces, they were done under health to benefit from the economies of scale, so that then the province procures for everybody, then we get our share. But maybe different provinces will say, what method did your province use? But in most instances, as the education department, we received our PPs from health, which we're buying for everybody in the province, but others may not have done that. There's something I've answered, only 2 grades have opened, so I can't remember what the question was.
70% occupancy of taxis.
Oh yeah, no, it's later on the 70 occupants. Or it was around teacher shortages and comorbidities. And I was saying up to now, because we only had 2 grades, so in high school we'll have 2 grades out of 5 grades. So they have been coping because teachers then have been syndicating and working together. So up to now, there have not been serious reports around teacher shortages. The challenges would have been, especially with your grade 12, you experienced teachers may not have been there, you use teachers. But if you're teaching in high school, you're qualified to teach high school. You may not have had the opportunity to teach grade 12, but your qualification is for you to be able to teach grade 12. And the major issue has been really about the experience and the exposure in that curriculum. And I'm confident that teachers will be able to support each other and will have the capacity. And some it's just that they never had the opportunity to do it. They were new in schools, there were people, and they could even make good teachers when they're given the opportunity to teach those grades. That,
grade R and lower, do they have to apply again?
Yeah, so even teachers who had really gone out can reapply and come back into the system. On grade R centers, we had said that the grade R system or sector, it's slightly different from the schooling system. So some grade Rs run in schools. Some grade Rs operate outside schools, in community centers. Some grade Rs, in the majority, are privately run. And you are saying private grade R centers, which are privately run, so which means they will not fall into some of the challenges that we have about PPs that have not arrived and anxiety of parents. Maybe those independent centers have already worked out with parents around issues of anxiety. And we're saying if they've worked out the necessary preparations, we say they must open. Some of the grade R centers run in private schools, right? So and private schools and small schools, even in round 1, we had said if they meet the requirements of health standards, they can proceed to take more grades. So some of the small schools would have already taken small other classes which were not admitted in your public schools. And we are saying those that had already started should not stop because others are not operating. We are saying those that were operating must continue. Those run privately and they have done all the work. They have dealt with parents, they've done orientation, and they have really engaged their parents. Because for us, the biggest thing also is to engage parents so that parents themselves can work with schools or with centers closely to manage the issues of anxiety, but to make sure that what is done at school is reinforced at home. So those who are saying they must continue, if they've opened, they must proceed. If they're private and independent and they qualify or they have satisfied the requirements, health requirements, they must be allowed to proceed. On closing, and I thought I made the point about closing and opening. We are saying out of the 25,789 schools, only 900 schools, and it's one too many, let me say, so less than 1,000 schools would have closed, open, closed, open. So which means almost 25,000 schools will not have been affected. And you will possibly hear, let me take in Gauteng. In Gauteng, they have 2,170 something schools. It's 100 schools. 100 schools, it's a lot. But 2,000 schools were never affected in Gauteng by closing and opening. So less than 4% of schools would have been disrupted, and mainly those schools come from the epicenter. It's Gauteng, Eastern Cape, and the Western Cape. And those schools, when they close, from the reports that we receive, they will not have closed for more than a week. So which means 3 weeks of the 4 weeks they've been teaching normally. And the MEC for Western Cape has explained that. The mistakes, maybe they'll explain the mistakes, but the reports I got were just pure COVID-19 related matters, where teacher had gone for, especially week 1, they had gone for testing. Results come 2 days after to say they are COVID positive. So the protocols tell you that because that teacher has been around, has moved around for the past 2 years, you have to decontaminate the place. And fortunately, so you have to make sure that you double it secure. So that teacher is supposed to have had masks, there was supposed to have been sanitation, but the fact that he was around other people, the place has to be cleaned and decontaminated. The way it happens, police stations with shops and everybody else. So it's not mistake. So when a Pick and Pay closes, it's the same issue that would have happened in schools or when a police station happens. So it's really your COVID-19 related challenges. I don't have to take all the questions. You can see maybe colleagues will help me whilst I'm taking water. Oh, hey, the minimus. Take others whilst I drink water because there are many things that there's so many.
Minister, it's fine. What I'm going to do now is go to the Western Cape. Let me go to the Western Cape. I can see there the MEC is ready and eager to respond to the questions which were directed to her. MEC, over to you. Ms. Schaefer.
Thank you, Eli. Thank you. The question was relating to the number of infections in teachers and learners and quite a few other questions. The total number of schools that have been affected is 525 schools, but that doesn't mean they're currently infected. So it's very difficult to give statistics because they keep on changing from day to day and doesn't really reflect the situation on the ground. As far as learners and teachers are concerned, we've been keeping data obviously from the time that we started opening schools. But what hasn't been brought into that is the number of people who've already recovered. So at the moment, to give a statistic for that is not going to be an accurate reflection of what the current situation is either. And we are currently working with the health department on that to ensure that we can give the number that are currently affected and the number that have already recovered, which is quite a few. So I will give that statistic, but once I get it finalized from health. As far as the number in hospitals are concerned, our latest report is that we have 4 teachers in hospital. And we don't keep statistics on private schools, unfortunately. As far as the EUSA call for stay away, as I've said previously, the only person who has the authority to close a school in the Western Cape is the head of department. He will do that in consultation with health authorities if it's deemed necessary. We have a lot of SGBs and other organizations now wanting to try and close schools, and I made the point earlier that is not acceptable. We can't have people just doing their own thing. People have the right to go to school. Our teachers have the duty to go to work, and we are providing a public service, and no one else has the right to stop people from doing that. So if people aren't happy to take their children to school, keep them out of school. There are provisions for that. But our schools will be opening, and we really hope that people will now come on board and help us to make it as safe as possible. Thank you.
MEC Western Cape. I'm now going to ask the MEC in the Northern Cape to respond to the questions that were directed to Northern Cape. MEC Jack, I hope you are ready to tackle the questions that were directed at you.
Yes, I'm ready, Elijah.
Please proceed.
Yes. Thanks very much, Elijah. And the questions are quite a few questions. Some of them are more of arithmetic. In essence, what I said is that during the first cohort, which was around the 8th of June, we received 37,000 kids back, which was grade 7 and grade 12. And then tomorrow we'll be receiving 40,000 kids back, and that is grade 6 and grade 11. 37,000 plus 40,000 gives you 77,000. Out of 306,000, it equals to 28.4%. That is the first one. The second one is on the infections. There were about 25 infections in total. One, educators were 12 that were infected. One passed on, so it gives you 11. Number of learners infected, 6. Number of officials, 1. Number of screeners, 2. Number of food handlers, 3. And that gives you 25 for the whole period. And then the number of schools that closed, 14 schools up to Friday, 14 schools closed and opened. And that is 9 reopened, 5 still closed. You would understand that what we do when we detect any person who's infected, we do the tracing, and we also then close the school, as the minister said, and as soon as that process is completed, we open the school after disinfecting the entire school, as well as cleaning the school again. So that is, in short, a response to all the questions that were asked from the Northern Cape. Thanks.
Thank you, MEC.
I can take one question I think I forgot to mention, if you don't mind.
All right, thank
It
you.
was the question about what are the consequences for parents who were not bringing their kids to school. As we had mentioned before, that it's understandable that different communities or parents will really respond differently to the virus. And that's why even the grade R staggering, it's really dependent on the school being able to interact and engage with the parents. But then on other grades, we had said, and I thought I had mentioned it, parents who continue to be anxious, one, according to SASA, according to the Schools Act, if a child absents themselves for more than 10 days, they're removed from the school register. But in this instance, we said we won't. We will give them more time so that when they feel much more confident or feel much more confident, they can bring, just to create that space for them. But what we've also engaged with, I've requested my officials to work with your home school, home education association to assist parents who want to register, because those are the people who can assist them more than us. But Sophie did mention also that, again, for parents who, because the home education may not be an easy exercise for most parents, because there are conditions around which you can register. You have to register, you must provide a program, and you might sometimes need guidance about how to really manage home education. So we have also provided assistance or guidance around the trimmed curriculum and how to manage it if you want to home educate, so that there's no negative consequences. We understand that you might really be genuinely anxious and therefore want to respond differently. It's different provinces, because it risks making us run parallel systems. I've been speaking to other principals in private schools where they had to run Microsoft Teams and they have to run school. For a system as big as ours, it may not be an easy thing to run parallel systems. But provinces have tried to accommodate parents who are unable to send kids for different reasons, to have cycles where they come and collect work after 14 days and then they bring it. Because then if you decide to homeschool, it really means that you have to assist us by taking most of the responsibility, because fortunately or unfortunately, in most schools where we have the majority of learners, the return rate has been up to 98%. So to dedicate too much time for 2% at the expense of 98 might be a very difficult thing to balance. And that's why we're willing to work with the 2% that is anxious to assist them to manage that space, whilst we continue to operate in a very difficult environment with the new norm and being and forced to really manage a system or an environment we're not familiar, or which we're not very familiar to. So we really appeal to work hand in hand with anxious parents to make sure that their kids don't lose out. There are no consequences, but we are, as I say, out there willing to offer assistance and help to make sure that those children are not left out and they are not disadvantaged.
Thank you so much, Minister. Can we go to the second round of questions? Ignatius?
There was a question on transport. I thought DG will answer for me.
Maybe, Minister, it might be taken care of in the next set of questions, because I've seen that some of them, they overlap. So we could just put it together in the next set of questions. Ignatius, please, over to you.
Thank you, Mr. Mhlanga. I have Sipa Kema from Newsroom Africa. In regards with grade R, Minister, can there not be a decisive decision on the return of these 5 to 6 years old? Some of the ECDs won't consider their state of readiness as they want money. And these are the small ones that fall through the cracks. There are already ECDs that don't follow regulations, that go unnoticed. Couldn't the same happen now? Could the grade R's not be accommodated in September as the weather will be warmer? We were told the change of weather has an effect on the virus. I have Arthur from Heart FM. Can we get a breakdown in terms of provinces where deaths were reported? I have Khomutso from Daily Sun. What will happen to learners who attend their grade R at the community-based organization, that's ECD centers, when they fall behind with curriculum? A second question from Khomutso. What is the main reason for the grade R to return to school earlier than other grades? And then I have Bongiwe Zwane from Newsroom Africa. The challenge of teacher-learner ratio is still there, and efforts are being made to deal with this. How big of a challenge is this to learning and teaching? The second question, what assurance does the department have for teachers who are more worried about their health more than teaching? And I have a third question from Bongiwe. Apart from a careful phase-in approach, what other support is being provided to provinces that are seeing a surge in numbers? And I have Zwandile Mbeje from SABC. Gauteng province has requested stricter restrictions, perhaps moving to level 4. Should the National Command Council grant the province, how will affect school reopening? Thank you, Mr. Mhlanga. Those are all questions.
All right, thank you so much. I'm going to move over to Peliswa. Do we have anyone on the line, Peliswa?
Yes, I have a follow-up question from Mercedes Besen from SABC.
Okay. Mercedes, please proceed.
Yes. I just want to say thanks to MEC Motshekga. You've given more than what I bargained for, but you have not answered the last question, which is around scholar transport. And I said to you, there are some parents who are complaining that the private scholar transport, has increased dramatically. And we know it's because of the social distancing issue. And these are children who go to public schools. And some of them, it is their grandparents who get social grants who have to pay their scholar transport, which used to be 500 rand, and now they have to pay 1,000 rand. So some of the learners now, they have to, they don't have transport to go to school. They have to take long distances, and then they have to use other alternative means. So what are you doing? What are you going to do to intervene in this regard? And what are you saying about this situation? Are you also aware thereof? And lastly, the minister, I think, thanks also for your for the various answers you gave on comorbidities, although it's not enough. But the other question that you did not answer is the issue around the investigation, you said, into alleged questionable medical certificates of teachers with comorbidities. How far is that investigation? Is it still being done? Thank you.
Thank you so much for that question, Mercedes. Any other question, Peliswa? Peliswa, do we have anyone else on the line?
No.
All right.
Yeah.
All right, thank you so much. Looks like I caught you off guard there. Sorry about that. Minister, I'm coming back to you now for the responses to the second set of questions.
Lots of things have been said about the virus, about how it behaves in winter and how it behaves amongst young children, and all sorts of information, so that even what we knew last month, the information changes. I mean, when we went into a lockdown, we rushed to close because we were told that, or we believed, no one told us, we believed that children were more vulnerable. As time went, we're told that the risk is more of children amongst adults, more than children themselves being at risk. So I think there's information that is going to come, which was shared with us at the network, to say, actually, in most instances, especially in South Africa, where we see infections amongst young people, it's because in South Africa, young children find themselves in the company of adults. Unlike in European countries where older people go to old age homes, therefore younger children are not so much exposed to adults. So that's why on an ongoing basis, we try to understand the virus and how it behaves itself and how it affects children. So having said that, I'm saying in terms of, was the question was, why do we open ECD centers in winter? Because it's young. ECD centers are extremely important in the system because through grade R, because we're not looking only at this year, we're looking at what happens next year. Grade R is supposed to prepare to have school readiness for children before they go to. It's a very important phase in the education system. But it's also important, we hear from pediatricians that if it's those that are in the foundation phase that are more at risk if they are not stimulated on an ongoing basis. Some countries, for instance, most countries in the world did not admit older learners. They started off at the foundation because of the importance of foundation phases. So they started, most countries didn't even close for the 9s and below because of the developmental importance of that phase. So if we had a way, and I think if we knew better, we could have really started with your ECD grade R up to the age of 9, because that's what we're told is the safest grade to bring into education. But a grade R also for young working mothers, for child care purpose, that's what schools are also for, to assist parents not only with education, but also with care. So the importance of opening your ECD on grade R is also around just the care and support for younger children. So the answer is that they're more vulnerable than other children. We're told that they're safer cohort to really confront the virus. That's what we're told by scientists. And actually we should have started off, that's why Western Cape is even working on grade 3, so that you put more support in your lower grades, in your foundation phase, because we're told those are the ones that are more at risk if they are not kept engaged and coordinated. And that's why we think we should do that. The differentiation for the grade R, and that's why, again, as government, we keep on making this humble request to committees to say, this is a very difficult environment that needs all of us. So that parents, with due respect, we request them to step up to assist. So that if your child is in a private school, it means you have made you have made a private arrangement with, not with government, but with that institution. So if children are in these private crashes, fall through the cracks, those schools, if they are not registered, which means the major responsibilities between that institution and the parents. So parents themselves have to assist government to monitor that children don't fall through the cracks, so that you don't, which is what parents do. They take a child and take them to a garage, and they can see that thing is not a school, and pay, and say, please look after my child. When things go wrong, to say, yeah, you see my child went to school in a garage. And by the time they were delivering the child in the garage, you were not there to be able to guide or support. So my humble request is that to avoid our historical problems where children are left to fall through the cracks, as government and parents, we have to get closer. And I can say, Chair, this time around, it's been amazing how parents have really come forward to make sure that they support schools and they support their children. So even with all the grades that we're going to face, including the ECD, the biggest request is to really get parents to work with government to sort out things. And that will apply for the scholar transport also. That's the question I was not able to apply. To say if it's a private scholar transport, what we were counting on, even in round 1, was the support around the regulations that had been put by the Department of Transport for everybody else. For learners that we transport ourselves, provinces would have told you we had to insist on the service providers that we use, that there must be physical distancing, there must be even transport monitors. So which means we are only able to monitor that which we have control over. But anything out of our control, we're not able to manage because it's out of our control. So on private transport, it's to really, again, as parents, to make sure that as they pay or commission people to transport their children, they make sure that there is safety regulations in place, because we cannot honestly say we can be everything every time for everyone. It's not possible, and will be misleading parents if we say we can. On private transport, parents must help take responsibility and ensure that things happen well. On the question of investigation, I thought I'd explained. The calls come to me, which is, and such is right, not the correct person to report to. So you report to the provinces to say, provinces, these allegations have come, especially your education labor council. make sure that as you screen, because this is what doctors are warning you, as you go through these applications, there are these allegations. And I did indicate that I will also speak, which I did with my counterpart, the Minister of Health, to say, Minister, I'm told there are these difficulties. Speak to the Minister of, because when I say investigate, I didn't mean that I'll bring police. Investigate to say, please follow up this. This is investigation. So speak to the Minister Senzo, okay, to say, we're getting these allegations. Please work with us to check if there are no loopholes in the regulations. And same, even say to the Education Labor Relations Councils, please make sure that this thing, we're getting these allegations, look into them and check if they're true or not and come back to us. And that's how far we have gone. But I can't go to the police. I don't have, they don't give me names, they're just advising me. So I said, no, we'll find out, we'll investigate how far prevalent this matter is. And this is what we have done in return. Did I ask everything? Or in terms of provinces that are not ready, what is it? We work with them. That's why we say on a weekly basis, the DG works with provinces. But it doesn't mean that as national we're the bearers of intelligence. That's why we have to work as a sector, as you see us here, to give each other support, to give each other advice, and make sure that we can move forward. And what is heartening is that in most provinces, education sits in provincial command teams. Even the request for deviations did not only come from MECs, it came from their command teams to say, looking at our situation in the province, looking at the infection rates, looking at our health capacity to be able to support schools, we will not cope with 52% of your learners. So once we had the report from the NECT, on the other hand, provinces through their command teams have been also making submissions. In terms of what Premier Makura says about strengthening what is strengthening the province's response to the ongoing infections, as soon as we get the proposal, we'll obviously have to interrogate it with the MEC, but also with colleagues in the sector, and even with the National Command Team, and respond accordingly. So I'm not able to respond to what I don't have before me, but what I know is that we will apply our minds and see how we ensure that it does not negatively affect education, because as I close, Elijah, the social risks are very high for vulnerable children in this environment. I'm sure you would have seen, especially in Gauteng, since schools have not been going, there are huge risks of juvenile delinquency. I see most of them now, even in most robots, they're dancing with crates. So you can see that there's a threat coming here. There are huge risk of juvenile delinquency. There are huge risk of youth criminality. As I said, the school we visited on Friday, 2 of the girls have now unintended and unplanned pregnancy. So there's also a huge risk of teenage pregnancy and all sorts of social ills. So working together with the committees to make sure, and even with the national command teams, I think it's a national responsibility, but it's also a humble request to say, let's pull together, because the risks are very high if things don't work well in education.
Thank you so much, Minister. Colleagues, that's it for today. There's so much more to talk about. There was a lot of information that was shared today, but the engagement continues. Tomorrow, the Minister will be at the Midrand Primary School at 7 in the morning, and from there, she will be visiting 2 other schools in that area as part of the monitoring exercise that we'll be conducting from tomorrow onwards. MECs in provinces will also be doing the same. Colleagues in the provinces will be sharing information on where the MECs are going to be. So please keep sending those questions. We'll try to give you the responses that you require, but we've made available all the presentations that were delivered here today. The colleagues are currently sharing those in the different groups and channels that we use in the media. That's it for today. Thank you so much and good night.
Thank you, Elijah.